I'm Bernadette Latson from the Department of Clinical Nutrition, University of Texas Southwestern School of Health Professions in Dallas, Texas. I'd like to talk about a best practice perspective in managing health consequences of aging. The number of seniors suffering from multiple chronic conditions is increasing. How can we better provide nutrition and support to help seniors prevent and manage chronic diseases? According to the 2011 Dietetics Workforce Demand Study, chronic diseases of aging, such as Alzheimer's disease and dementia, will increase the demand for dietary interventions as older adults are more likely to be admitted to hospitals and nursing homes where dietitians will oversee their nutrition. The Institutes of Medicine report entitled Health Professions Education, A Bridge to Quality recommended that all health professionals should be educated to deliver patient-centered care as members of an interdisciplinary team. The World Health Organization's report on a framework for action on interprofessional education and practice states that interprofessional healthcare teams are a solution to the delivery of cost-effective and efficient care for both individual patients and the community. The University of Texas Southwestern School of Health Professions has implemented a best practice solution to training effective healthcare teams. All first-year students from 7 distinct disciplines within the school are enrolled in a 2-semester interprofessional education course called Interdisciplinary Development, Education, and Active Learning. The acronym is IDEAL. The disciplines involved are from clinical nutrition, medical laboratory science, physician assistant, physical therapy, prosthetics, orthotics, radiation therapy, and rehabilitation counseling. The IDEAL course was developed by an advisory group from all departments and programs in the Southwestern School of Health Professions. The broad goal was for the course to facilitate the ability of health profession students to actively collaborate and communicate in simulated patient care. There are 3 learning objectives for students in this academic year. 1, communicate one's roles and responsibilities clearly to patients, families, and other professionals. 2, describe the roles and responsibilities of an interprofessional healthcare team in the management of an older adult with Alzheimer's disease and mobility limitations. 3, explain how an interprofessional team collaborates to formulate a recommendation for the residential placement of an older adult with health and medical conditions. Students enrolled in the course are divided into small ideal groups consisting of a facilitator and 10 to 12 students representing all of the professions from the school, with every profession represented in every group. The groups meet bi-monthly with pre-assigned topics and roles. Topics include behavioral styles, communication skills, healthcare team dynamics and dysfunctions information, behavioral modification, cultural competency, ethics, and professionalism. The theme in this academic year focused on aging, so activities in the small group discussions included a family case, Mr. and Mrs. Cooper, and grand rounds type presentations continued that case-based format. Students learned about the roles of different professionals on the healthcare team of Mrs. Cooper, an 87-year-old lady with Alzheimer's disease who recently fell and suffered a hip fracture. The patient also has osteoporosis and mobility limitations. Each discipline contributed to the patient-centered decision-making, with the Cooper family in transitioning Mrs. Cooper through acute care, skilled nursing, and onto a residential facility. Through this exercise, students were exposed to the roles of different health professionals, and they practiced working respectfully with patients and other professionals. In addition to the small group interactions, student meetings, the IDEAL course included monthly grand round types lectures featuring faculty presenting research and clinical topics related to aging. One afternoon was designated Convergence Day and included a keynote speaker, The Science of Aging Fair, demonstrations, activities, and snacks to foster collaboration among future healthcare professionals. Student evaluations of the Ideal course showed positive outcomes for understanding and awareness of communication and teamwork skills. The long-term need for healthcare for the growing number of older adults with complex chronic medical conditions will require better use of the skills that all healthcare professionals bring to the table. Training of entry-level health profession students with courses such as Ideal reflect a response to that need.